crossed so y'all can video now. And I'm here, your doctor has ordered your insulin and then also ceftriaxone for your respiratory infection. Is that okay? Okay, so I'm going to go outside and draw that out. Real quick, let me check your name and date of birth. Can you tell me your name?
Yes.
Okay.
It's Marfa. 9/14 of 68.
Okay, interesting name. Okay.
70.
I'm going to go draw up medications and I'll be back. Any questions about your medications? It's ceftriaxone. It's going to be an IM injection. Well, probably, is your thigh okay? Is that okay if I use that side? And then insulin for your diabetes. Okay, and I'll make sure your food's in the room. Okay, so I'm coming out, right? Hand hygiene. You can choose to put on gloves to drop the medication. You do not have to. I prefer not to, but I did do hand hygiene, okay? Okay, so first I want to drop my insulin. You can, as long as you don't use somewhere where you've touched, you can use a different part. Does that make sense? Okay, so I clean those. All right, I'm looking here at what has been ordered. All right, so 10 of N. Okay, actually, before I do that, back up. Checking the expiration date. We are good. It's only expired 5 years. And this, okay? So then I'm going to get a new alcohol pad. Some people do that. Have you seen them do that?
Mm-hmm.
You can do that too. Okay. All right. So now I'm ready. So 10. So first I'm going to put my air. Okay. And then 6. Be very careful so I don't bend the needle. Okay, so 6. There's an air bubble, so sometimes I choose to pull out some more and then put it back in because that got rid of that air bubble. Okay, so we're right at 6. Will you be my RN? What do you see?
6
Of what?
of the, I don't know, can't see, arm.
Perfect. That's what I wanted. Okay, and then I need 10. Already put the air in, right? This has to be perfect. Good. Good, good. Okay, what do you see now?
16 of N.
Okay, that's what I wanted. That aside, I do my dosage calculation. I need 1 ml of this. Right. I'm checking the dose, making sure it's not expired. Okay, I've already reconstituted it. All right, so I need to do 1. I'm going to do the air. I'm not going to core. So I'm going to go from the side and then straighten up, do my air. And I'm going to withdraw 1 cc. That's a big air bubble. That's huge. So sometimes I can squirt it back and try to get rid of that air bubble. Got rid of it, and let me try again. It's thick. Okay, that's better. Okay, you don't have to verify this, okay? That's okay. Sometimes it does that because we reuse them, so the pressure. So sometimes it squirts out. Okay, I'm not going to recap unless I do it the right way. I'm standing here. What am I going to do before I go in there again?
Check.
Right? Okay, so I'm doing my second check. Okay, so I'm checking. We're good. We're good. Okay. All right. So, hello. Are you ready for your injections today?
Yes.
Okay, so this is my bedside table that was in here. All right, so I have your food right here. So as soon as I give you your insulin, you need to be sure and eat. If you feel shaky, lightheaded, headache, anything like that, please let me know, because sometimes that can be, oh, those are small. So sometimes that can be a sign that your blood sugar is either high or low, okay? Which one do you want first?
I'll take the insulin.
Insulin? Okay, all right.
That's a smaller needle, right?
It is, yes. So where did you have your last insulin injection?
It was right here on my left
Okay.
side.
So is it okay if I go on your right?
That is fine.
Okay. So 2 inches from the umbilicus would be about right there. If you'll just hold that for me. All right. Got alcohol. All right. Are you ready?
I'm ready.
Okay, it's going to be hard to pinch this because it's big, right? Oh, gosh. There we go. All right. All right. And then shark's container kind of shot out, didn't it? Okay, I'll take that from you. All right, so next I need to give you your ceftriaxone. Is it okay if I do it in your thigh?
Sure.
Okay, so that's your vastus lateralis. They can either be sitting or laying supine. He's sitting, so I'll just go with it. I am going to raise up the bed. Okay, to find the landmark, it's the greater trochanter right here, and then above the lateral femoral condyle. See how it makes a rectangle? So it makes a rectangle and it's right in the middle, okay? You don't want to be too high up there or too far back here. Okay, so greater trochanter right there, and then it's in the middle. Okay, so about right there is my site. Can you hold that kind of sort of for me? All right. So this shouldn't hurt. Just try to relax. If you relax, the muscle doesn't tense and it'll feel better, okay?
You're not the one getting this.
I'm an expert though. I got something clean. Okay. And you know, people, well, I won't go. Okay, so I'm going to Z-track. Are you ready? All right. Aspirate 1, 2, 3, 4, 5. Give slowly. 1, 2. Okay, I've done it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, we're done. How bad was that?
Oh, not bad at all.
Okay. All right. So I got your food. Here it is. Go ahead and eat for me. Any signs and symptoms of hypo or hyperglycemia, please let me know. I'll lower your bed. Do you have any questions?
What would be some signs of hypoglycemia?
Hypo, it's different for each person, but usually headache, lethargy, like if you feel tired, confusion. What do you normally feel when you get
I
low?
usually get dizziness.
Yeah, dizziness, absolutely. Yeah, hunger, sometimes hunger. And then hyper, what do you usually feel? Sometimes it's thirst, irritability.
Always upset.
Upset, yeah, very
Pee
emotional.
a lot.
Yeah, absolutely.